they do anything?
Yeah.
Okay, we are here at the emergency department with our patient Caitlin. She is a 50-year-old white female. She is a fast-paced career woman. She orders DoorDash quite frequently because she is so busy, and she is here for complaints of chest pain and scene.
So Caitlin, you were telling me that you mostly sit for your job.
Yes, I work in an office, so I sit all day.
Okay. But you're very busy all the time.
Yeah, I have 10 kids. So
Wow.
yep,
Okay.
I'm always running around. When I'm not at work, I'm at home with my kids.
Okay. So what is bringing you in today?
Last night I just started having a lot of chest pain.
Okay. So I see here that we did an ECG and you're not presenting with a heart attack. So we're happy about that, but chest pain can be early signs of coronary artery disease, which means that there might be plaque building up in your blood vessels, or that your blood vessels are really constricted and causing high blood pressure, which is also called hypertension.
Okay.
Has your doctor ever mentioned any of those things to you?
No, what causes that?
So what kind of foods do you eat?
Oh, well, me and my kids, we usually, and even at work, we'll get DoorDash, so.
Okay. So what kind of things do you DoorDash?
Cafe Rio, McDonald's, Chick-fil-A.
Okay, so those foods have a lot of salt in them. And salt can definitely increase your blood pressure and that constriction in your vessels. They also have a lot of fat in them that can build up that plaque, which is kind of like a substance that starts to narrow those vessels, so it makes it harder for the blood to go through. When you've gone to your doctor, what has your blood pressure reading usually been?
It's usually like 145, 140s, 150s, over 90, 110.
Okay, so we would count that as high, and that could even be bordering and making its way into high blood pressure, hypertension as a diagnosis. We'll have to talk with your doctor more and see if that is the diagnosis. So here at the ED, we're going to treat you with what's called metoprolol tartrate. It is a fast-acting antihypertensive that, what that means is that it's going to act on your heart. There's certain receptors or like places in your heart that control the force that your heart beats and the rate at which it beats, and those are going to slow that down a little bit and take the workload off your heart, so it's not pushing as hard, it's not pushing that blood as hard through those vessels, and it can breathe a little bit. It's going to take some of that pressure off.
So that will lower my blood pressure?
Yes, that's the hope and the goal. Okay. That's what the drug is intended to do. So the one that we're going to give you here works quickly, so it should help alleviate some of that pain. And then we're going to recommend that you go home with a prescription for a once a day medication that helps to prevent any more chest pains, and if you ever hear the word angina, that's what they're referring to, is that pain in your chest.
Okay, I've seen on like Grey's Anatomy that sometimes if you take antihypertensive drugs, it can like make you dizzy. Is there anything like that I need to worry about?
Yeah, absolutely. So antihypertensive, the goal is to lower your blood pressure, and when that happens, sometimes, you know, your brain needs blood too. So you can get dizzy, you can get drowsy, and when you take this first dose, you're probably going to want to take it at night, because these drugs can have this effect when you take your first dose where it actually like overdoes its job, and it makes you very low in blood pressure. And if you were to go from sitting to standing, your blood pressure might drop very quickly, and so it could make you very dizzy, potentially even pass out. So if you were to get up in those situations, we suggest taking it before you go to bed so that you're laying down and there's not as much chance for you to fall. If you were to get up, we just suggest that you let your feet dangle, let yourself, if you feel any dizziness, wait to continue getting up, let yourself adjust to the positions and let your blood pressure come back up.
Okay.
So I just want to make sure that I have everything in here. So when you go to take this drug, you're gonna wanna monitor your blood pressure and your pulse regularly. Those first couple weeks, we suggest having a blood cuff or a blood pressure cuff. Either, you know how you can go to the grocery store and like put your arm in the thing and have it test you? That's one way to do it. Or they do have ones that you can pick up either at the grocery store or at a medical supply store. I don't know if you have one of those near you, but we can look.
Okay.
And keep that on you. The first couple weeks, you want to monitor that probably every day.
Okay.
And also your pulse. So they make little clips that you put on your finger. You know the one that we put on here. It measures your pulse rate and it tells you right there. And so we want that to stay between 60 and 100. If it's below 60, we'd want you to call your doctor.
Okay.
And do that before you would take your medication, because we want to make sure that it's safe for you to take your medication.
Okay.
With that, there is an FDA warning about abruptly stopping your medication. It can actually cause like a rebound hypertension. So what that would mean is that your blood pressure would get high really fast. And so it could cause a lot of problems and potentially cause a heart attack, which is what we're trying to avoid.
Okay, so if I were like on vacation and I lost my pills or I ran out, or if I only had like a couple left and you can't just abruptly stop, how do I stop if I have to?
So we're gonna have to make sure that if you are getting low on a medication, you need to call so we can get that prescription refill in. And if you're going on vacation, we're gonna make sure that you have enough pills. And if you were to lose it, we would want you to call and we can get an emergency script sent to a pharmacy close to where you're at.
Okay, and if in the future I need to get off of it, how do you can't just abruptly stop it? Do you have to like take another?
So we could wean, we could go to lower dosing. And we'll assess that as we go through. Hopefully, we can do some diet and exercise changes, get you up and moving a little bit more, reduce the salt and the fats in your diet. We might be able to get you to a point where you don't need this anymore.
Oh, that'd be great.
It would be great, and we would love that for you because that's our goal, right? We don't want to have to be treating you for this.
Yeah.
So are there any other questions that you have about this medication?
No, I think I asked all my questions.
Okay. And do you feel confident? Can you tell me what you're taking this medication for?
I'm taking this medication to lower my blood pressure.
Okay.
And my heart have less of a workload.
And what pulse rate are you looking for when you check it?
Anything between 60 to 100. If it's below 60, call my doctor.
Awesome. And with taking your medication, what is the most important thing about your refills?
Is that I have to get them refilled or else I can have rebound hypertension and it can go really high.
Okay, perfect.
Heart attack and stuff.
I feel like you really know what you're taking this for.
Good.
And I believe that you will be successful with this.
Okay.
So if you don't have any more questions, we will start getting you discharged.
Okay, thank you.